Welcome to Part 3, the ethical guardrail. As we bring intelligent systems into our workflows, we must ask an important question. Who protects the patient in a digital system? When an algorithm generates a risk score, when a predictive model influences staffing, when data begins to guide decisions, who ensures that fairness, dignity, and equity remain at the center? The answer is the professional nurse. In this section, we shift our focus again. You are not just a user of technology. You are the ethical safeguard within it. Your role is to ensure that efficiency never replaces compassion, that speed never overrides safety, and that innovation never eclipses equity. Artificial intelligence can calculate patterns, but only nurses can protect people. Many people assume that mathematics is completely objective. If it's numbers, it must be neutral, right? But artificial intelligence is not neutral. AI systems learn from data, and data reflects history. If the historical healthcare data includes disparities, such as differences in access, treatment, or outcomes, the algorithm can learn those patterns. In that way, AI acts like a mirror. It reflects the priorities and biases that already exist in the system. This is sometimes called development bias. It means that if the past was unequal, the machine may unintentionally repeat that inequality. Unless we intervene, unless we question it, unless we monitor it, artificial intelligence does not create bias on its own, but it can automate bias if we are not careful. And that is why nurses must stay engaged. Digital health has a dual nature, like a balance scale. It carries both risk and responsibility. On one side, we see the risk. Algorithms often rely what we call proxies, indirect measures that stand in for something else. For example, some models have used healthcare spending as a shortcut to estimate illness severity. But spending is not the same as sickness, right? If certain populations historically had less access to care, lower spending does not mean lower need. When we use incomplete proxies, we risk incomplete conclusions. The lesson is not that technology is flawed. The lesson is that data reflects history. Now look at the other side of the scale. Technology can also improve equity. Subepidermal moisture scanners, or SEM scanners, measure tissue changes beneath the skin rather than relying on only visible redness. This allows earlier detection of pressure injuries across diverse skin tones. Here, technology strengthens fairness. So what do we learn? Artificial intelligence is neither inherently harmful nor inherently helpful. It reflects the system we built. And that is why ethical governance matters. Technology amplifies intention. Nursing ensures that intention remains human-centered. This brings us to an important new concept, algorithmovigilance. On the left is something we know well, pharmacovigilance, medication safety. As nurses, we do not simply give a drug and assume it is safe. We assess, we monitor, we question when something does not align. We actively safeguard patients. Now look at the arrow. It says evolves into. Pharmacovigilance does not disappear. It expands. On the right is algorithmovigilance, the AI safety. As digital systems influence care, we apply the same vigilance. We monitor algorithm outputs, We ask whether predictions match the patient. We watch for error, bias, and drift. Algorithm vigilance means continuously evaluating AI for safety. This is not a new identity. It is an extension of who we already are. We have always protected patients from harm. Now we also safeguard the systems that guide their care. Look at this decision pathway. An AI output is generated. The first question is simple. Does this match the clinical picture? If yes, we act. If no, we pause and report the discrepancy. That is algorithm vigilance in action. Now let's make it practical. If a sepsis alert does not trigger, but your patient is clearly deteriorating, that mismatch matters. If a staffing prediction suggests your unit is adequately covered, but the acuity and psychosocial needs are overwhelming, that discrepancy matters. If a discharge prediction says a patient is ready to go home, but you know they do not understand their medication or lack support, that gap matters. In each case, the nurse becomes the safety filter. We do not ignore the output. We do not blindly accept it. We evaluate it. And when it does not align, we document the concern through established safety reporting systems, not to blame the technology, but to improve it. See something, say something is not a slogan. It is a professional stewardship in a digital system. This is where your nursing role becomes essential. As intelligent systems become part of healthcare, one thing remains constant. The nurse is responsible. Professional nursing organizations are clear. Technology can support practice, but it cannot replace professional knowledge, skill, or ethical accountability. We do not delegate ethics to a machine. An algorithm can calculate probability. It can estimate survival. It can analyze patterns, but it cannot understand a patient's fears. It cannot interpret their cultural values. It cannot weigh their goals of care. Only a human can do that. And in healthcare, that human is often the nurse. You are not simply users of technology. You are the ethical safeguard within it. As systems become more intelligent, your responsibility becomes more visible, not less. Technology can inform decisions, but you remain the moral compass guiding those decisions. And that is the heart of professional nursing practice. Let's pause and reflect on what this means in practice. Here's our third guiding question. In AI-enabled healthcare environments, what is the nurse's primary responsibility as an ethical safeguard? A. Delegating decisions to intelligent systems. B. Ensuring AI outputs align with clinical judgment, patient values, and safety. C. Limiting the use of technology in care delivery. D. Managing software development processes. The correct answer is B. Ensuring AI outputs align with clinical judgment, patient values, and safety. Here's why. An algorithm can calculate risk. It can generate probability, but it cannot understand a patient's cultural values. It cannot recognize subtle social contexts. It cannot advocate for dignity or autonomy. That responsibility remains with you, the nurse. Being an ethical safeguard does not mean rejecting technology. It means integrating it wisely. It means asking, does this recommendation align with the patient in front of me? Does it respect their goals of care? Does it promote safety? Technology can inform care, But nurses ensure that care remains human-centered. That is not a diminishing role. It is an elevated